A lot of people ask me what a crown is, and when I tell them, they usually react one of two ways. They either look at me all confused, what'd you just say? Or they act like it's the end of the world. Are you trying to kill me? What is a dental crown, and when would you need one? Hey guys, my name is Amanpreet Singh, and I'm the founder of Dental Secrets. Before I get started with the video, make sure you hit the thumbs up button and subscribe to my channel below. Let's get into it. A dental crown is basically like a baseball cap or a helmet to help protect your tooth. The way this works is your dentist would basically drill down your tooth to a stump. When doing this, he or she would have to make sure that you have good visible margins around your tooth. Without these clear visible margins, it would be really hard to know where the crown should end. After drilling the tooth down and seeing that you have good visible margins, the dentist would probably pack a cord in your gums. This is basically like a mini rope that would go into the gums that surround your tooth. The goal is to reflect the gums so the margin is more easily visible. And I know this sounds painful, but luckily you're numb during this part. After this, the dentist would probably check if there's any bleeding, and if there's not, now's the time for the impression. This impression can be done one of two ways. It can either be done the traditional way, which is that gooey way that you're used to, or it can be done the new way, which is basically taking a digital scan of your tooth. If it's done the traditional way, this impression would be sent to a lab, and that lab technician would make a stone model that looks like your teeth. Using that stone model, the lab technician would look at that crown prep tooth and they would design a crown that would be best for your mouth. And this requires a lot of communication between the dentist and the lab because everything is going to be custom made for your specific tooth. The way the lab designs a crown is going to determine how you bite with your opposing teeth, and it's going to determine how well the crown fits with the teeth next to it. We want to make sure you can still floss after the crown is seated. The lab technician will usually design the crown using wax, and they'll use this wax to make the crown out of either porcelain, metal, or whatever material is chosen. Once the crown is done, they'll send it back to the dentist, and the dentist will bring you in to get the crown delivered. So this will take at least 2 appointments. I have to go to the dentist again. Sometimes an office can actually make a crown for you the same day. The way that would work is they'd have to scan your teeth and get a digital model rather than a physical model of your teeth. Once they have this, the dentist can design the crown to the exact dimensions that they want. The last thing the dentist would need would be an in-house miller. This is basically a 3D printer that would print your crown the same day. Both of these are good options, but a lot of dentists will not have that in-house miller. They're pretty pricey. So why do you need a crown, and what is the point of even getting one? The most common reason is when the decay is so big that a filling won't work. This can be an old filling that has new decay starting to form, or it can be a cavity that was never treated. But if that filling is too big, that tooth structure is going to be too weak to hold that filling in place, and the tooth could either crack or the filling could just fail. That's why it's better to put a crown over the tooth and prevent it from ever breaking. Another reason you would need a crown is if there's a crack in your tooth. A crack can happen for a lot of reasons. Sometimes you have a larger filling like we talked about before, and this is really common with those silver fillings. But this can also happen if you're a really big clencher, or if you're a grinder, or if you just have a really strong bite in general. And if you combine being a clencher with having a filling in your tooth already, that's even more likely that your tooth could crack because your tooth is already weaker now that you have a filling. That's why it's better to protect the tooth before the crack gets any bigger. But sometimes the crack is too big, and it can get to the nerve supply of your tooth, and then you would need a root canal. But sometimes the crack goes even bigger than that, and the only solution is to get the tooth out and put an implant. Another reason you would need a crown is if you get a root canal. Almost any time you get a root canal, your tooth is going to need a crown. And the reason is when you get a root canal, you are basically killing the tooth. That means there's no more blood supply, and the tooth is no longer remodeling and remineralizing on its own. And over time, the tooth is way more likely to become brittle, to break on you, or to form decay. And another reason you would want a crown is more aesthetic reasons. This is really common in your front teeth when you have discolored, misshapen, or just teeth that look weird and you want to revamp and make your smile look better. This is also something a lot of celebrities do. So one really common question I get is, why do you remove so much tooth structure to make a crown? Well, the crown itself needs a certain thickness in order to work. If it's too thin, it could actually fracture and it would be pointless. Or you might have to remove tooth structure from the teeth next to the crown, but you might as well remove it from the tooth that's already getting the crown rather than a healthy tooth. One of the biggest mistakes dentists actually make is under-reducing a crown prep and being too conservative. And sometimes you just have no choice. If the decay is already so big, or if the old filling is so big, then you have no choice but to remove that to make your crown. Another common question I get is, does it hurt? Well, everyone is different and everyone has different pain tolerances. The actual procedure should not hurt because you're going to be numb, but I can't guarantee how you're going to react afterwards. I will say that if the decay is really deep, then there's a better chance you're going to be sensitive for a while afterwards. Also, your gums might be sore for a few days because they tend to get irritated during the procedure, but they usually heal on their own in a few days. And if the decay does go really deep and it gets close to the nerve of your tooth, sometimes it does not heal on its own. And sometimes it can cause shooting pain in the middle of the night. If this ever happens, then you probably need a root canal. But I will say that most of the time, my patients don't have any problems with their crown. And they usually don't even realize that they have a crown in the first place. Are you sure you put a crown on my tooth? Thank you guys for watching. I hope you liked that video. If you had any other questions or wanted me to talk about something, please let me know in the comment section below. And if you haven't already, please hit that thumbs up button and subscribe to my channel below. We'll see you in the next video.